It's coming from me. I fixed it. The Frontline Workers Pay Working Group will come to order. A quorum is present. We have an agenda today that includes both testimony from DEED as well as public testimony, and there are a number of people with tight schedules. So we're going to try to get moving and get through a number of them as quickly as possible, and then we'll have some time for discussion afterwards.
Mr. Chair.
Senator Murphy.
Thank you, Mr. Chair. I'd move approval of the August 3rd minutes.
Senator Murphy moves approval of the August 3rd minutes. Any discussion? Seeing none, all those in favor, please say aye. Opposed, no. Aye. The motion prevails and the minutes are approved for August 3rd. Thank you, Senator Murphy. We will start with DEED. We have a presentation by Cameron Mock, Regional Analysis and Outreach Manager and Acting Assistant LMI Director. I believe Commissioner Grove is also available. And so I don't know if you want to start out, Commissioner, and introduce Mr. Mock, or if you just want to get going, but I'll leave it to DEED to get started.
Thanks, Mr. Chair. Good afternoon, members. Good to be with you here virtually. I'll be brief. Really eager to dive into the presentation from Cameron. As Chair Winkler said, he is our Regional Analysis and Outreach Manager, also our Assistant LMI Director. Just one kind of broad comment before we dive in. The data that you're going to see here has been compiled using the best information that we have, and it uses as a starting point the presentation that House and Senate staff gave at the beginning of this process in terms of the ways we could think about various categories of workers. As in any presentation of data, it's likely to spark additional questions that members of this committee might have about other slices of data, other occupations, other industries. That's natural and that's good. I think as we consider next steps and additional analysis you might want to consider, I think to coordinate that and refine it and make it easier for us to manage and handle, we would ask that those requests go through the chair and the vice chair and through me, and then we can appropriately funnel them to Cameron to make sure that we're getting information that is needed. So if that's all right, we'd like to proceed in that way. And I think with that, I'll turn it over to Cameron, eager to hear his presentation and have plenty of time for questions. Thanks, Mr. Chair.
Mr. Mock, if you would identify yourself for the record and proceed with your presentation.
Yes, Chair Winkler, Vice Chair Housley, members of the working group. My name is Cameron Mock, and I am the Acting Assistant LMI Director and the Regional Analysis and Outreach Manager for the Minnesota Department of Employment and Economic Development. Thank you for the opportunity to present to this group with information that can help provide a better idea of the universe of workers included in the selected industries. I'm here representing DEED's Labor Market Information Office. Sorry about that. We are tasked with producing employment and economic statistics in cooperation with the U.S. Department of Labor's Bureau of Labor Statistics. LMI includes unemployment rates, wages and salaries, projections, and more. And it is our pleasure to serve the citizens and businesses of the state of Minnesota. At the first work group hearing on Tuesday, July 28th, Carlin Doyle Fontaine, the Senate counsel, provided a brief presentation with the stated goal of helping to explain federal definitions of frontline and essential workers and transition to how Minnesota has defined frontline and essential workers with regards to the pandemic, assuming that that might be helpful for the working group as they formulate what might be included in their definition of frontline. She listed off several possibilities to help the working group get started. While these definitions are often still broad and unfortunately do not match directly or exactly to available data, which is classified by industry codes, in the following slides, you'll see how DEED has worked to provide estimates of the worker universe for each option and also provide some of the limitations of the data being requested. That will need to be considered when figuring out how to make any of these options actionable. After compiling a count of jobs for each option, we also divided 250 million by each of the estimates to illustrate what a flat rate payment might look like. With that, it's important to note some of the limitations of the data. In this set of slides, we will present job counts from DEED's quarterly Census of Employment and Wages program. All establishments covered under the Unemployment Insurance Program are required to report wage and employment statistics quarterly to DEED. These data are edited and verified for research and analysis purposes. The UI program covers about 97% of Minnesota employment, but workers and jobs that are excluded from these statistics include proprietors and the self-employed, railroad workers, family farms, full-time students working for their school, elected government officials, insurance and real estate people, and others who work only on a commission basis. In the following slides, we will present an annual average across the past 4 quarters, but the actual number of workers in these industries will be slightly different due to employment churn and other potential complications with the data. To that end, this is a count of all jobs, regardless of the number of hours worked in the quarter or the length of time employed in the year. A person that worked 1 hour for pay during the quarter will show up as 1 job, the same as someone who worked 80 hours per week throughout the entire time period. Also, one person may hold multiple jobs in multiple industries. In other words, someone might simultaneously be employed as a cook at an elementary school and a dietary aide at a nursing home, and they therefore may show up twice in these job counts. There are also other issues of job churn and mobility that would need to be considered when looking at this data. The job count data also does not reflect whether the job holder was working directly with patients or customers or working in an office or any other setting that would not require face-to-face contact. Telework status is also not available in this data, although we do have industry and occupation teleworking estimates at the national level from the Bureau of Labor Statistics. We do not have that data at the employee level. So we cannot definitively say which individual workers were working at home versus working at the work site, or for what periods they were at home or at a work site if that varied over the course of the pandemic. The QCEW job counts also do not distinguish between the job level or responsibilities of each worker. It counts every position, including the chief executive officer or clerk or certified nursing assistant or cook. This highlights some of the confusion that often occurs between industries and occupations and the complications that this work group will face. People may think of healthcare workers as being doctors and nurses, but there are many more people who are employed in the healthcare industry, including many that are not healthcare related workers at all, such as billing clerks and cooks and housekeeping cleaners. QCEW data cannot provide a list of people who are employed as CNAs. However, we could provide a list of people who work at establishments that are classified as hospitals, nursing homes, or home health care services, which all employ large numbers of CNAs. In every case, there will be challenges. Please keep in mind that the limitations that our agencies have with the data that is available, and we will do our best to help explain what is or isn't possible. As noted earlier at the first work group hearing on Tuesday, July 28th, Carlin Doyle-Fontaine, the Senate counsel, provided a brief presentation where she listed off several possibilities to help the working group get started. While these examples are helpful, they are sometimes still broad and unfortunately do not match directly or exactly to available industry-specific data in our QCEW program. In the following slides, you'll see how DEED has worked to provide estimates of the worker universe for each option. This includes Executive Order 2020, which was based on CISA guidance, the phases MDH used to provide guidance on who should receive the vaccine first, proposed legislation from the 2021 legislative session, specifically House File 41, and analysis from the Center for Economic Policy and Research. Senate Counsel and House Research also proposed that several states have done pay programs, which we could certainly look to for guidance at the direction of this work group, working through the chair and through our commissioner. Senate Counsel mentioned the CISA critical infrastructure sectors guidance that was provided by the federal government and used as the initial framework for determining critical versus non-critical sectors in Executive Order 2020. This list highlighted broad industries including healthcare, manufacturing, agriculture, public administration, transportation, financial services, and more. To make it more manageable, we interpreted this very broad list at a more detailed 4-digit NAICS code level to make the best matches possible. Of the 286 subsectors with employment data in the state, 172 were deemed to be critical at the time. As such, this is the largest of the proposed options and originally included more than 2,350,000 workers in the state. With a $250 million fund, this would equate to $106.11 per worker. Another option that Senate Counsel suggested was based on the Minnesota Department of Health's priority list for vaccinations, which is available on their website. While their guidance focuses on both people and industries, we did attempt to match them up to sectors as closely as possible using data from our QCEW program. Phase 1A was directed at the healthcare workers, which broadly included just over 385,000 workers in the state. Phase 1B, Tier 1, added in childcare and elementary and secondary schools, which is another 156,000 workers. Tier 2 was food processing, which covers 45,500 jobs in Minnesota. Tier 3 was much more broad and included higher level industry classifications such as agriculture and manufacturing, which by itself has more than 300,000 jobs in the state, as well as retail and public administration. In sum, the entire Tier 3 grouping came to more than 515,000 jobs. Finally, Phase 1C also included broader sectors like energy, finance, transportation, and also career fields that are sometimes confused as industries, such as IT, communications, logistics, and more. This added another 305,000 jobs to the total. The count of jobs in these sectors identified by MDH for vaccine priority came to just over 1.4 million workers over the past 4 quarters, or just over $177 per worker. Next, Senate Counsel Carlin Doyle Fontaine referred to HF 41, the Essential Workers Emergency Leave Act, which includes some detailed sectors such as public safety, public schools, air transportation, building services, childcare, food sales, and hotel accommodations, as well as much more broad industries such as healthcare, manufacturing, and retail trade. Of note, the last 3 are the 3 largest employing industries in the state. In sum, then, this grouping accounts for more than 1.3 million jobs in the state of Minnesota, which would equal $189 per worker. Additional definition would be necessary to determine what specifically should or should not be included in these groupings. And then finally, Senate Counsel also referenced the Center for Economic Policy and Research, which was linked to by the CDC website for vaccine prioritization and also had data available for all 50 states. Their analysis showed more than 650,000 jobs in Minnesota based on 2014 to 2018 census data rather than our more current QCEW data. But it did at least provide clear NAICS code definitions that we could follow. So looking at 2020 QCEW data, the largest number of jobs in this grouping were in healthcare and social assistance, which accounted for nearly 440,000 jobs in the identified subsectors. Since this work group also needs to include it looking more specifically at long-term care, this would likely include 42,850 jobs at nursing care facilities, more than 25,250 jobs in home health care services, and 65,750 jobs at other residential care facilities, which includes continuing care and retirement communities and assisted living facilities and residential and intellectual and developmental disability and mental health facilities. In addition, the identified retail and wholesale trade subsectors also provided nearly 153,500 jobs over the pandemic period, with the largest number working at general merchandise stores and supermarkets and grocery stores. In sum, there were just over 690,000 jobs in these CEPR identified industries in 2020, which would equal $361 per worker. Please note that in each case, we would be available to provide the specific NAICS codes and employment counts that make up each of these worker universe estimates. And through our commissioner and working with the chair, we could add or subtract them from these different groupings as the work group decides. With that, I'm available to answer questions.
Thank you, Mr. Mocht. Questions from working group members? If you are on Zoom, raise your hand. Or Commissioner Grove, I don't know if you want to provide any closing comments.
No, Chair, I think love to hear the questions that members have. Thank you.
So members participating remotely, use your raise hand function, and we will call on you. So, Mr. Mocht, I have a whole bunch of questions, but I don't want to jump in ahead of anybody else. So as I look to see hands raised, we will jump in. Representative Frazier.
Yeah, we probably, thank you, Chair. We probably got the same question, so I'll get us started. Thank you for the data that you have provided. My question is, you initially at the beginning, you kind of laid the caveat that some of these workers could be counted twice. My question is, I mean, given that you gave these the data with the numbers of what a possible payout would be for the total number of workers, we know that that's not accurate because some folks are double counted in those situations. And I want to know how long would it take for us to drill down on that data to make sure we're not double counting folks so we can get an accurate idea of what the accounts may actually be for payouts?
Mr. Mock?
Chair Winkler, Representative Frazier, it would have to be based on a data sharing agreement between DEED and the Department of Revenue, and I'm not sure what the status of that would be. It would also be based on how this work group decides how to pay out. So if it only is going to people rather than jobs, we would have to use the QCW data to then remove any duplicates people who were holding jobs in multiple industries that were selected as frontline workers. So without knowing the universe that we're starting from, it's a challenge to provide that estimate.
Representative Frazier.
So am I hearing that it's impossible, or this may take some time?
Mr. Mock.
Yes, Senator Frazier, I believe that it is possible, but it will take some time.
Okay. Would you
Representative
be,
Frazier.
oh, thank you, Chair. Would you be able to, what do you believe the soonest you could get back to us on how much time it would take to do that?
And Representative Frazier, if I could just jump in, and Mr. Mock, if you could also tell us very clearly what the steps needed or what pieces need to be put in place in order to do that, to meet that timeline.
Thank you, Chair.
Mr. Mock?
Yes. So Chair Winkler, I might actually refer this to our commissioner as well, because this would be a joint project, and without knowing the size of the universe, it's hard to say exactly the time commitment.
Commissioner Grove.
Yeah, Mr. Chair, Representative Fraser, it's a good question. And this is a question we've had to ask ourselves throughout the pandemic and a whole host of other programmatic areas. These issues aren't as simple as they seem, and they do oftentimes require data sharing agreements and extraordinary amounts of analysis. So I would say that we should park that question until we know the universe we want to tackle, and then do the analysis or see what's possible in terms of the analysis given data sharing agreements. It's still not going to be perfect. And I think our hope today is to provide this initial look to give you a sense of the altitudes that are there. Yes, there's going to be some duplication, but this does give us a sense for, based on the priorities of this committee, the size of the benefit we want to give, the kind of our view of the world we want to take, what the general look is. Once we have a perspective and a point of view there, then I think the question of implementation of deduping and data sharing comes into play. But I don't think that comes into play at this stage of the conversation, because these estimates are close enough such that they give us a view of the universe that's helpful for decision making.
Representative Frazier.
Well, let's try this. Since we have House File 41 that went through quite a bit of hearings and was fleshed out quite a bit, can we try with that universe?
Commissioner Grove.
Again, Representative Frazier, I want to be clear. This isn't something we can just go back to our office and do and get back to you next week. It involves a lot of complex steps to dedupe these lists. I think a better use of our time here is to figure out what data you all want that you don't have. We're not worried as much about the deduping at this point, because we're trying to get a sense of the universe. I don't want our team to go through a whole host of complex analysis and deduping and data sharing agreements for a universe we might not even end up agreeing is the one we want to tackle. So I would again recommend that we look at this data as a good estimate of where we might start. And then if there's an area where we think we're going to need to get into the absolute granular detail of every worker, we find a way to get at that analysis.
Yield.
Representative Frazier.
I'll yield.
Okay. Representative New Brindley.
Thank you, Mr. Chair and committee members. And thank you, Mr. Mock, for the presentation. I appreciate this. Lots of good information here. And I guess I'm not sure that this question is for Mr. Mock or maybe for the chair. I'm just wondering, you know, one of the things that we discussed earlier on is how many of these groups also received federal funding, received funding from other sources versus those who have not received additional funding yet. And I'm wondering, where might we get that information as well? I know we mentioned House File 41, and obviously there's lots of different groups delineated here and lots of different ways that we could look at this. It seems to me, and it seems like from our previous conversations, I hope others agree, that House File 41 using that information is clearly too broad. That, you know, it seems like most of us have a goal of sort of a meaningful award, and I'm not sure that that would get us there. But, you know, like I said, we could perhaps start sort of winnowing this down by looking at what groups have received funding from other sources throughout the pandemic.
Mr. Mock or Commissioner Grove?
I would just, I mean, Mr. Chair, Representative Brindley, or New Brindley, sorry, I think is a fair question. Maybe one better directed at House or Senate research in terms of additional federal programs that are rolled out. That's not something that would be unique to a deed database. You know, just thinking out loud as a fellow member of the commission, I would think you might be referring to such things as the FFCRA, which provided some leave for those who worked at employers of 500 or less. And some of those programs, I don't know if you're referring to unemployment insurance as another source, but it'd be helpful probably for House and Senate research to understand, you know, which other benefits you're looking to analyze that these workers may have availed themselves of. But certainly this is the first time we're considering a direct payment program like this. So there's not something else that has happened on that front at either federal or state levels.
Representative New Brindley?
Thank you, Mr. Chair, and thank you, Commissioner. I appreciate that. And yes, I do think that would be helpful information. I know that certainly at the state level and federal level, there has been a lot of additional funding, for example, in childcare and E12. And so it would be helpful to know where that is. And so again, perhaps that, as you said, Commissioner, that would go towards council if they could start looking into that information. Yeah, I would just reiterate, I appreciate this, and I would just reiterate that I hope that we continue to focus on those frontline healthcare workers, long-term care folks, et cetera, who we know were certainly taking the brunt of the burden throughout the pandemic, because we certainly have our work cut out for us on the committee here to winnow down this group to ensure that we do have a meaningful award. Thank you, Mr. Chair.
Senator Murphy?
Thank you, Mr. Chair. And I knew we would get to this place, and we're beginning what is probably the work in earnest of this panel. And so I'm going to offer my thinking as a way to participate in the dialogue, mindful that we are going to get to points in which we are either struggling to make sure we get the right data that we need, and also that we are probably going to have disagreements over who's in and who's out. I don't know about everybody else on the panel, but I am certainly getting emails now from people who are making very, very articulate cases for why the work that they have done in different settings meets the standard of frontline worker. And they're also in their emails being very clear about the risk and the benefit that they provided to their community, to the people in their care. And I think that is important, and I know I'm not the only person getting that. And the charge for us in finding the right line to draw for who is in and who is out is central to this work. I want to be really clear that from my perspective, if we draw a tight circle around healthcare workers and long-term care workers and people who work in assisted living, while I understand and believe that everybody in that pool would be deserving and there would be money to make a meaningful contribution, I believe we would be leaving necessary people out. When I think about the meat packers or people who worked in grocery stores, et cetera, and I don't need to enumerate the list. I am grateful for the presentation that we've just gotten from Deed, and I hear the commissioner wanting to make sure that we're being as clear as we can, so when they ask the staff to do the work, that it is not done in vain. I'm worried a little bit about the vagueness of some of and it's detailed, so for people who are listening but not necessarily looking at this handout, drilling down and understanding numbers of people by category is really helpful, but that there are people inside of these pools that probably work from home. at least for me, raises a flag about who's in and who's out. And one that I think I want to flag for the commissioner and for this panel, because while, I had the benefit of working from home and I'm grateful for that, I think that disqualifies me, not to mention the fact that I am a state official. That disqualifies me from being contained in the frontline worker pool. So I think we have to sort that part out. I also believe, in part because there was a lot of work done in the House, especially on House File 41, that we should not disqualify or set aside the work that was done to understand who might qualify, and would want us to continue to use that as a benchmark, because it did the intricate work of understanding over the course of the pandemic who had been touched and who had not been touched. And so while it might not be the perfect yet, I do think that it is an important benchmark that we should be measuring against, because it's been tested, there's been a lot of testimony, there's been lots of questions, and because it's thorough. And then the last thing I'll say about the data, and this is probably more a question than a comment, I am curious about the intersection between vaccine priority and frontline worker, and wanting to make sure that it is not a blanket, because we know that there are people who are not frontline workers who did end up in priority sections of vaccine. And so I think it is important to tease that apart. So if you're in a hospital, for instance, but in the back room doing accounting, you may have been early in terms of priority, but not necessarily a frontline worker bearing the same risk as somebody who's taking care of a patient or delivering a meal. So as I think about this first blush of data, I just want to raise those questions to make sure that on the record people can hear, and for the consideration of the panel, an argument for why we need to think broadly and discreetly about this data. Thank you, Mr. Chair.
So Representative Murphy, is it kind of a question you'd like an answer to or response to now, or?
Thanks, Mr. Chair. If it is possible to get an answer to that question now, that would be fantastic.
All right, Mr. Mock, if you can address that.
Yes, so my understanding of the MDH vaccine priority is the same as yours, that everyone who was working at a hospital would have had access to a vaccine regardless of the specific responsibilities of their position. And for what it's worth, from the data side, we are in that same category. We have a count of jobs at hospitals. We don't have a count of jobs at hospitals that are accountants versus RNs versus CNAs or whatever other occupational title it would be.
If I could add an answer to that, Mr. Chair, Senator Murphy.
Commissioner Grove, just to be clear, I have Senator Kiffmeyer on the list, but I think you're responding to this, so I'll go to you, Commissioner Grove, and then we'll go back to Senator Kiffmeyer.
I am, yeah, thanks. I just wanted to, since we're on this point, stand up for a second. Thanks, Mr. Chair. I just want to highlight, this is the fundamentally most challenging part of the data set, is that we have data by industry, but not by occupation. And we talked a lot about this in our team as we thought about how can we best help guide our understanding of the economy for this panel. That's the big gap. And there are certain ways you could get at it. You could use, trade association estimates of occupation breakdowns in industries and try to apply some kind of a proxy percentage, cut to the overall bucket. You could certainly survey employers. That's time intensive. And I'll tell you, Dee does that all the time, and it just takes a lot of time, and there's no guarantees. We have some other survey data that we could use, again, as proxies. But I think all of these things are going to be estimates. And so it's a helpful thing to understand about where our limitations are, and I think it will play into implementation of whatever decision we end up making, because we're not going to know perfectly a list of every single person when we start unless we have data that comes from employers themselves. And so it's a thing for us to consider, and just wanted to elevate that point, Senator Murphy, because I think you're raising the right questions here.
Senator Kiffmeyer.
Thank you, Mr. Chair. And I appreciate the discussion and all the information. It's all very helpful. So questions I have for Commissioner Grove or Mr. Mock, do you have data in regards to full-time, part-time, number of hours worked, or if they worked remote? And then I have a follow after that one.
And thank you, Senator Kiffmeyer. I would also, if you don't mind, add the question, if you don't have it in your agency, is it something that you can acquire through work that you do?
Be great.
Commissioner Grove.
I'll cede to Cameron on this one.
Mr. Mock.
Chair Winkler, Senator Kiffmeyer, yes, that is information that we would have available through QCEW data through our wage records. We would have a count of the number of hours and the wage that the person earned, and also the amount, like the tenure of the person during the time period. We would not have the ability to say whether they were working from home. I don't believe that data set exists.
Okay.
Senator Kiffmeyer.
Yeah, thank you, Mr. Chair. I think it's very helpful to know what the capability of the data is. I think that's an interesting part of that. The other thing is federal rules exclude managers, directors, executive level because they are not frontline. So are you able in your data to also have access to that information?
Mr. Mock.
Mr. Chair, Senator Kiffmeyer, we do not, through the UI wage records, have the capability of saying what a person's position is. But as Commissioner Grove was stating, we could make proxies using our industry occupation matrix, or also using our occupational employment and wage statistics survey that we conduct with employers in the state of Minnesota. But there is no data set that answers your question directly.
Senator Kiffmeyer.
Yeah, thank you, Mr. Chair. I think that's what's going to be our challenge here is access to the kind of data that addresses the question. And the big thing is frontline workers. Again, the value and the effort and what they've all done, no question about it. But I think when I read through the federal rules, it is very much to be focused on those who had direct care responsibilities. And I think it's important for Minnesota that we be aware of those federal rules, not that we mean well, but might run into federal audit issues in a future date. And I think in reading through those rules, I think that the House Senate staff might have had some discussion about that, but as I read the actual rules, which are much longer than the summary of the presentation, it's really quite clear about direct care frontline workers. And I think we ought to, I think that's going to help us as we go forward. Though there are many worthy people who have worked really, really hard, I think that federal rule definition is going to be important consideration. Be aware of that, to know that, and if they've been working remotely, no matter the title or class or number of hours, they're working remotely. So I don't know that would be called a frontline worker. And so the question is how to get a hold of that data. And it seems to me that the only way to do that is from an employer themselves. Maybe somebody else can address that. How would we get that kind of data for those who are working remotely?
I am seeing unified head nodding from Commissioner Grove and Mr. Mock, but I wonder if one of them could speak on the record.
Okay.
Thank you, Mr. Chair. Senator Kiffmeyer,
Commissioner
I think
Grove.
that's right. Sorry, yes. Thank you for the question, and I think that's right. We would need that kind of granularity from employers to be absolutely sure who worked where and how. So you could either get that data and use that to inform decision-making, or get an estimate that ballparks enough such that you feel like you have the information you need and you make your framework, and then develop a mechanism such that people apply either through employers or the state or what have you. But we don't have that data on the front end. And I think given the time window we have, and again, this is more speaking as a member of the commission versus, responding to your question, I think there's a real consideration for this group to take in terms of, can we get data from employers in the time window needed to help inform decision making. We can certainly get data from them to inform payments once we've made our decision, given that may take a little bit longer. But given we have a bit of a window here, I wonder the viability of employer data in a short window. It's a question I raised for us again as a working group just to think through.
Senator Kiffmeyer.
Mr. Chair, thank you, Mr. Chair. I think that is important, and time is going to be also important as well. And so I think, especially the Hospital Association, Long-Term Care, Assisted Living, they know probably with a greater degree of some certainty that they're going to be included in this in one measure or another. And I would highly suggest to them that they begin gathering their own data such that they do have knowledge and have that data, and that it would be helpful to be in compliance with those federal rules, that they consider that and not wait necessarily another month or so, because that time is a big issue in regards to our getting these things out and done as quick as possible. And I would encourage them, or if they would like to testify as to what that means to them and what they might need to do, so on and so forth. So we may need to hear from them first in regards to that viability, but I think that kind of conversation would also be very helpful to hear from them or to start the work, whatever you think, Mr. Chair, as a future next topic idea maybe.
Senator Kiffmeyer, thank you. I do think getting organized is important. I also want to just acknowledge the fact that industries that have a close relationship with state government for funding are best organized to represent the needs of their employees or their workers and what their numbers look like. But other industries, for example, meatpacking, aren't typically engaging with the legislature or the executive branch in the same way that hospitals or nursing homes are. And so we don't want to put the workers who could potentially have suffered greater frontline health risks and greater economic harm, which is in the state law that we passed, at a disadvantage compared to industries that are better organized. So while I agree with you, I also think we have to make sure that we are looking for the mechanism to reach the workers who aren't as closely tied to employers who come here all the time and can present easily to us and are organized for that purpose.
Yeah,
Senator
Mr.
Kiffmeyer.
Chair. Yeah, I was giving that as an example, such an obvious example because it's in statute, but I do intended to say that anybody who was thinking that might want to think about preparing internally to have some consideration for that. But yes, any industry that may have been mentioned or is on the federal rule list would be the sort that it would be helpful to know, but also help us to really know the quantity so that we can make some determination on meaningful amounts for any of them.
Representative Frazier.
Thank you, Mr. Chair. A couple things. One, Senator Kiffmeyer, thank you for adding that. I do want to point out that some of the organizations or industries that you are noting that could bring this data, part of the arguments against House File 41 were arguments of just that would be very onerous, or that they could not or would not be able to obtain that data to ensure that those workers would have received the benefits from House File 41. So I just wanted to point that out because you may run into that roadblock as you raise that suggestion. So just to note that.
Sure.
The other point, this is back to Mr. Mock. I'm on your website, and I found that there is a section titled Teleworking During the Pandemic, and there are estimates there, and I was wondering if that data is outdated now, is why you continue to say that you don't have that data, or if that data was just, is that data you just wouldn't think that we should not use?
Mr. Mock.
Yes, Chair Winkler, Representative Frazier. I actually wrote that article, so I'm super familiar, and I did mention it during the, during the presentation as well, that we do have national level estimates from the Bureau of Labor Statistics. In their current population survey, they actually added a question specifically asking about teleworking due to the coronavirus. And so we can certainly extrapolate those national estimates to our industry and occupational categories in the state of Minnesota. But again, it won't give you an exact count of the number of people who were actually teleworking in the state. And our wage records, again, will not be able to provide that level of detail. We certainly could provide an estimate of the workers in the industries identified who had the opportunity to telework during the pandemic period.
Representative Frazier.
Thank you. Thank you, Mr. Mock. Yeah, I did know that you wrote the article. That's why I raised it. Good work on the article. I did read it. So the other thought is, I do think that information would be helpful, considering we have this time crunch to where we're trying to make a decision here. I think any data that we can gather in this time frame would be helpful. So I think even estimates would be helpful at this point.
I have a couple of testifiers who'd like to testify before one or need to, and so I think we need to start to wrap up the conversation here. But I do think, I guess I propose this to the commissioner or Mr. Mock. It sounds to me like if we developed criteria that we want to use to evaluate how to make decisions for distributing funds for which worker categories, not categories, but which workers would qualify. So for example, we've talked about the fact that if you telework, you shouldn't necessarily be eligible for this funding. Or if you were only working, just a few hours or during this time period, and it was maybe different from somebody who worked full-time or consistently throughout the pandemic. That if this working group developed a set of criteria that we could potentially then ask the agencies to determine if they could get the data that would allow us to make that decision. That doesn't necessarily lead us to a question of how many workers qualify or how much per worker, but at least we could find out whether or not our criteria is something that we could even get data for in order to use as criteria for providing workers hero pay of some kind. I don't know if members have any kind of reaction to that. Commissioner?
Mr. Chair, if I could, yeah, I think that's a really wise statement. I think our goal is to provide as much information as we possibly can to guide the decision-making of this body. And I think it'll be easiest done, again, if we go through yourself and through Senator Housley, just so we have one sheet we're pulling from. And in terms of some of these estimates, again, the criteria will really matter in terms of coming up with the data. And we'll just be really honest with you along the way. Is this data that is super accurate? Are we using third-party proxies like the telework study that Representative Frazier just mentioned as a way into just thinking about it? Obviously the size of the universe helps determine the decision that we make. And then there's the implementation question that will come on the other side of this, which is how do we actually distribute the money, and does the data help us get there too? So I would think that's a great strategy, Chair Winkler. I think that's a good way to move forward. We'll use whatever data sets we can. I think on the data cleaning issues and on absolute accuracy, that's where I think I'd rather we stay in the world of as close as we can get at this point, given those activities are extensive research projects. I think if we can get the universe roughly defined based on whatever criteria this group wants to put forward, that will help us, and we'd be happy to proceed in that manner.
And to be clear, I believe it was Senator Murphy who first suggested to me proceeding at using criteria as a benchmark rather than a sector. We may have to organize our hearings by sector to make sure we're understanding each of them better, but I think using criteria and figuring out if we can even get answers to those questions would be a potentially good way to go forward. Representative New Brindley, and then we will go to testifiers.
Thank you, Mr. Chair. I would just add, I hope that as we are collecting this data, we also consult with Commissioner Malcolm. As I look particularly, and frankly, I 100% agree that each and every one of these groups were essential workers and are essential workers in our state. However, I would say that not all are created equal. For example, hotels are on this list, and I think hotels were able to modify their practices, their cleaning practices, et cetera, to really mitigate risk. And I'm not sure that we ever saw any breakouts or hotspots in those industries. And I think we also need to take those things into account. While everyone certainly was dealing with a certain level of fear, the level of risk was not necessarily the same among all of these essential workers. And so I hope that we will also consult with Commissioner Malcolm to find out and to dig in a little bit more where the risk really was as well, so that we can use that and help that to define what we're doing with this as well.
Thank you, Representative New Brindley. Okay, thank you for the briefing from Deed. We will hear from DLI, which I think will report on some of the industry or geographic locations for outbreaks, so that which is collected by health, but it will kind of have a worker safety framework, so we'll be informed by that as well. And Department of Revenue will also be here to talk about their ability to provide the kind of mechanics of payments and other issues that will help us identify a mechanism for following through on this. So much more to explore on the technical side. And I would suggest that committee working group members develop a list of potential criteria, and if everyone writes their own and submits it, we may find that we have a lot of overlap, and potentially if the committee could develop a common set of criteria jointly, we could at least proceed on that basis and narrow the workload. Representative Frazier.
Thank you, Mr. Chair. Just to Representative Renley's question about the outbreak data, we did request that data, and the Department of Health is working on it. So we're hoping we'll have it sometime next week or the week after. But it's going to take some time, but we did request it.
Great. Thank you, Representative Frazier. Okay, so we will move on to public testimony. I have at the top of the list Michael Pack and Christina St. Germain, and it's my understanding that they have a 1 o'clock deadline. So we will try to move through those, and then we'll move on to the others. So do we have Mr. Pack? I see him on the screen. If you could identify yourself for the record and proceed with your testimony, we would like to hear from you.
Good morning. My name is Michael Pack, and I am a DVS examiner and inspection specialist for the state of Minnesota. I'm also a member of the AFSCME Council 5 Local 3142, and I represent over 100 examiners throughout this state. And we are asking that you would consider us and determine a plan as you determine the plan to distribute funds for the frontline workers. At the end of March 2020, we were all sent home for a few weeks during that initial shutdown. As Minnesota started to get a grasp of the new virus, examiners were brought back in for the reopening. By late April and early May, our days were filled with completing CDL exams, which take about an hour and a half to complete. It soon progressed into, as the examiners, we were sitting in 15 to 20 minutes at a time in each vehicle. We completed 15 to 24 road tests per day. That works out to be somewhere 6 to 8 hours a day, 5 days a week, with a lot of us doing overtime. We did not know if the customers were infected or not, and we were just hoping that they weren't infecting and not spreading it not only to our families and our workers, but also to each car that we got in. Plus, then we were urged strongly by the authorities, our authorities, and the state representatives to complete 81,000 exams by October to catch up on all the missed exams and the backlog that we had before the pandemic. We knew that if we didn't reduce or eliminate that backlog, that our work could be privatized. And we're proud to say that we did make a big jump in the number of tests, and we did it every day. It took long hours and working weekends and taking a lot of risk in contracting the COVID, but we did it. Many of our examiners contracted the virus due to being just so close to examiners. Within that 6 foot, I mean, you're sitting in a normal car and it's 2 to 3 feet, if not that. So we as examiners even kept our clothes at work and would come with new clothes on and then and get into the old, in the work clothes and vice versa when we would be leaving. And none of us were ready for the crowds of people that came to our station starting back on May 18th. The state concentrated 15 main hubs, even though they had 93, and kept the rest of them closed. They created new health screening positions and were created to screen the customers. So examiners were responsible to screen customers and direct them into specific lines. And numerous episodes of angry customers and were reported both to the union and my phone and email. Statewide, it was reported that the lines were down the street and not even close to 6 feet apart. And my question to you, have you ever been surrounded by 40, 50, 60 people all coming with this new virus potentially all coming around you clamoring to get that new real ID or that enhanced license, the license renewal road tests and written tests. We were overwhelmed, and I, for the first few weeks, directed hundreds of people that stretched throughout our strip mall where we're located in and tried to separate them by 6 feet. In fact, it even bled off into another medical clinic that's right near us. And we didn't have medical gowns or medical shields or a ventilation system that could protect us. Most of our stations were equipped with only a couple of boxes and some wipes. And so as you can consider this, a lot of us limited our time with our families, and especially those the close families that had compromised systems. All this was done not knowing if we were affecting our family, not knowing if we would have a job or would it be sent off to privatized settings. We just did our job, and we served this state and tried to keep up with the pleasant attitudes with dealing with screaming and yelling and angry attitudes during this COVID pandemic. And I would say to you, it would be such a blessing to recognize my coworkers and reward these fine people for the risks they took and are currently still taking. Thank you. Do you have any questions?
Thank you, Mr. Pack. Questions from committee members? Senator Murphy.
Thank you, Mr. Chair, and Mr. Pack, thank you for your testimony. And I just have one question about the expectation of screening, as you say, the customers. Was there pre-screening before people came to their appointment? Was there just screening that happened at the site of the appointment? And can you tell us what was engaged or what was involved in that screening?
Okay, so
Mr. Pack.
So what we did was this: we got everybody lined up and down the strip mall, and they would have to, when they came to the health screening area, there wasn't any pre-screening or anything like that. Anybody could come on up, and we would find what they needed to do, and that's why I mentioned all the things that we were talking about. We would ask them the 4 questions that the state asked us to review with them, and hopefully they were being honest. We would take their temperature, get their information in case we were a spreader or anything like that. And once they passed all those things, they were allowed first in the building and such. The driving exams was a little different. They did the pre-screening up at the health screening area and the temperature, and then they would go in the cars. So it was left on the honesty principle.
Thank you, Mr. Pack. Senator Murphy,
yeah, thanks,
we have
Mr.
one more
Chair.
testifier who's hoping to go before 1, so
I will hold my question then.
thank you. Thank you, Mr. Pack. We have Christina St. Germain.
Hi, thank you for having me today, Mr. Chair Winkler. Good afternoon, members of the Frontline Worker Pay Working Group. My name is Christina St. Germain. I'm a security counselor at the Minnesota Sex Offender Program in Moose Lake. I'm an ASME Council 5 member, and I'm the president of ASME Local 1092. I'm here today on behalf of the members to share some of the challenges our members have faced over the past 18 months. My role and the role of my members are security counselors that always require us to be in direct contact with clients that have contracted or been exposed to COVID-19 in the facility. The Minnesota Sex Offender Program in Moose Lake is a congregate living facility with hundreds of clients and staff on site at any given time, breathing the same air and exposing one another to the spread of the deadly virus. There is no way for us to guarantee social distancing at all times, and we were not provided with adequate PPE. If you weren't a nurse or part of the A-team security counselors, the other security counselors, were not provided with N95 masks until after the virus was in the facility. And that was limited to a certain group of people as well. While we were able to keep the virus out of the facility for nearly 8 months, when it did come in, it was devastating. My job as a transport security counselor and others was to drive the infected clients to the hospital and provide 24/7 coverage, sharing the same air. After the hospital staff, after the hospital said staff needed to have an N95 to be in the operating room, the transport staff were N95 fit tested. While our administration team struggled to find a balance of our safety and the public safety due to the supply of PPE, we security counselors spent 8 hours in the hospital rooms with clients who are on aerosol-generated procedures. The hospital nursing staff were so concerned with our safety, they provided us with their own N95 masks, even though they might have run short. They were new, just so you know. But it was too late for the multiple security counselors who contracted COVID-19. One of those security counselors is now a COVID long hauler, and this didn't have to happen. We should have had the proper protection. While providing security coverage in the ICU units for weeks with my union siblings, I watched multiple community members die, in addition to watching 3 of our own clients die. One of our security counselors volunteered to work on our COVID positive unit. She was there for over a month to reduce the amount of staff exposure. Despite all the precautions, she still contracted COVID-19 as she wasn't provided an N95 mask to work the COVID positive units. We were told that a paper face mask and a face shield was adequate enough. In late November, the situation at work became dire. 25% of our staff were out sick with COVID. The quarantine unit that held the infected clients was full, and the isolation unit as well was full. The overflow was nearly full, and our entire facility was on a lockdown. No client workers were able to make meals. Everyone from the maintenance, security, clinical, clerical workers helped out to make 450 meals 3 times a day during this time period. We are very concerned with the Delta variant, as not all security counselors are N95 fit tested. We are inquiring about our stock of N95 masks in our warehouse and seeking to have all security counselors N95 fit tested before we have another outbreak, so we won't experience the exposures we did last year. This has caused tremendous anxiety for us when we went home at the end of every shift, wondering if we'd be exposing our families to a deadly disease, but we still reported to work every day because our jobs as essential workers require us to. Everyone who endured the increased risk of uncertainty during the worst global pandemic to keep our state essential services functioning should be recognized and compensated financially. They are the true heroes. Federal government provided the funding. It's not costing the state anything, and it's not fair to cut out any essential workers for the funds that are provided to the state. I thank you for your time, for listening to our concerns, and we are proud public servants. Thank you very much.
Thank you, Ms. St. Germain. Do you have time for a question or two? I know we're a little bit over.
Yes, I do.
Questions from working group members? Senator Murphy.
Thank you, Mr. Chair. And Ms. St. Germain, thank you for being here to tell that part of your story. And I don't have a question, and in fact, I know you and I had a chance to speak a couple of weeks ago. But I think what you have described for us is an experience in a facility that, without your testimony, we may know about an experience, but not hear about it. And both you and Mr. Pack, in your testimony, sort of remind us of the beginning to the middle to where we are now in the pandemic, and our flat-footedness as a society in responding, the lack of N95s, the fact that for 8 months the virus was at bay, but then once it was there, how quickly it spread, and what that meant for you. I don't have a question. I just want to thank you for taking the time, and I know it's brief, to share that with us. And I hope that you'll remain available if we have questions and follow-up after today.
Thank you, Senator Murphy. Okay, and thank you, Ms. St. Germain, for your testimony and for your service. Next on our list, we have Dr. Deborah Messenger, followed by Waleed Sonbal and Sophia Montoya. Dr. Messenger?
Hello, my name is
Yes, I
Deborah
can remain.
Please go ahead.
Messenger. Okay, my name is Deborah Messenger, and I am a leader with the Kids Count on Us Isaiah Coalition. Kids Count on Us is made up of over 500 childcare providers, as well as families and teachers across Minnesota. We are fighting for a more equitable, affordable childcare system for parents, as well as one that treats our childcare teachers as real teachers with higher wages and opportunities. I'm an office manager at All Ages and Faces Childcare in St. Paul. I have been teaching and working in childcare for over 20 years. My goal is always to provide a safe, caring environment for young children to learn and grow. Early childhood education has always been essential, excuse me, for families across Minnesota. This need has been illuminated even more because of the pandemic. Years of chronic underfunding to our childcare system, coupled with added pandemic safety measures, pushed many centers and families to the brink. Even before the pandemic, directors were struggling to pay our teachers what they're worth. Many I know, myself included, took pay cuts rather than to close our doors. When the pandemic hit, it was a total stressful situation, I know, for everyone. Fear of the unknown, whether or not you're going to be able to keep your doors open, whether you're going to be able to retain employees, was a nightmare in itself. The staffing that we have are hard workers. Many of the parents that we do serve are part-time students. Some of them work in the healthcare sector. A lot of them don't have health care, and a lot of our workers are on, our parents are on CCAP. We have had the situation when the pandemic did hit that 90% of our families withdrew out of fear. So that left us kind of sitting, not knowing what to expect. I know teachers' wages are low, especially in the child care sector. They make on an average to start $14 to $15 an hour. I do understand that. In closing, I want to say, working with a working group will make more recommendations on how to distribute the $250 million. Some are calling it a hero's pay. All essential workers are heroes, especially those keeping us healthy, fed, and safe. Childcare workers are definitely unsung heroes. We don't want to take anything away from other deserving workers, but we definitely deserve to be recognized for the important role we play in our economy and our future. And I'd like to say thank you.
Thank you, Dr. Messenger. Questions from committee members? Not seeing any. Thank you for your testimony. Next up is Waleed Sonbal, followed by Sophia Montoya, and then Berenice Gallardo. So, Mr. Sonbal? We don't have him at this time. So we will next go to Sophia Montoya.
Good afternoon, committee. My name is Sophia. I am a 17-year-old high school student, college student, daughter of a meat plant employee, an essential worker, granddaughter, organizer with Unidos Minnesota, and I am also an essential worker. I still remember the day they called off school. We all thought this would only be lasting till 2 weeks, and this would just be a small break for all of us. I quickly learned that this was not the case for myself and many of our community members. COVID hit us hard here in Nobles County. It seemed like we were the pilot of what to do during an outbreak. We felt alone and forgotten, but as an organizer and community, we came together and started calling out for help. We reached out to local and state officials and entities. Some answered the call and some looked away. While you looked away, You didn't see my fear of going to work as a CNA in a nursing home and possibly getting them sick or vice versa. The fear of myself bringing COVID home, my mother couldn't afford to get sick or even quarantine because she would have to do this without pay. To many Minnesotans, this fear was and is real. So since I have you in front of me, I am asking you to please think about every Minnesotan who is an essential worker. Recognize what they have lost and ask yourself, is 250 million even enough? I urge the committee to consider increasing funding for all our Minnesotan essential workers. Thank you for your time.
Thank you, Ms. Montoya. Questions from committee members? Not seeing any, so thank you for your testimony. Next up, we have Berenice Juarez Gallardo, followed by Courtney Huber.
Hi, hello, good afternoon, everyone. My name is Berenice, and I live in Wade Park. I am member of Faith and Justice. And I want to tell you that I came to Minnesota with many dreams. When I arrived, I only thought about working. I was 14 years old, and I started working 12 hours a day, 6 days a week. I had 3 days of training, and then I started working as an employee who already had experience. I didn't imagine the work will be so heavy. My arms were very sore from working long hours and 6 days a week. When the workers got sick, we couldn't rest. We just took pills for the pain and keep working. The workers that go to work sick because we don't have benefits and we don't have a workers' union either. The salary is very low. I don't want to live like this forever. That's what I decided to go to school, and I want to have a better future. America benefits from our work because we are hardworking people. So I want to ask the Minnesota representatives to include farm workers, menis, and food packers in the distribution of the money that has been approved. Thank you.
Thank you for your testimony. Questions from Senator Murphy has a question.
Thank you, Mr. Chair. And thank you, Ms. Juarez Gallardo. I'm wondering if you could share with us just a little bit more about your experience as a farm worker and
Sure.
talk a little bit about the experience of you or your coworkers and the potential infection or outbreaks that you experienced.
Ms.
Yes.
Juarez?
Yes. Un momento. So, I am undocumented, so I was here for 14. When I got here, I was just 14 years old, and all my family live like this, so I want a better future for me and for them, and for all the people who work hard and
Hi, this is Maylena Gutierrez. I got her custody. Her parents were killed in Mexico, and she immigrated here to survive. So she was working on a farm, and I found when I was doing the Know Your Rights, she asked me for help, and she asked me and see if she can live with that. So I asked for her custody, and she lived with us now. But she was working for long hours in a farm, 12 hours a day, and not going to school.
I really appreciate
Senator
that,
Murphy.
Mr. Chair. I really appreciate understanding a little bit more about your story. Thank you.
Thank you for your testimony. Courtney Huber?
Members and Commissioners, my name is Courtney Hubert, and I live in Northeast Minneapolis. I'm here today to voice my support to this working group in favor of providing frontline worker pay for essential workers. I've lived in Minnesota all my life, and I joined UFC Local 663 in 2004 at the Cub Quarry in Northeast Minneapolis. Currently, I transferred to the Cub Foods on Lake Street in South Minneapolis after we reopened. As you know, grocery workers were designated as essential in March of 2020 when the COVID-19 pandemic began. In retrospect, the times before were wonderful. I worked overnight, so I would go into work at 2 a.m., do my 8 hours, and go home. I can complete a grocery order in under 2 hours and order unlimited numbers of cases of food any day of the week. It was simple. After the pandemic hit, it was insane. My shift started earlier because writing an order took nearly 7 hours. We were limited to 1,000 cases, therefore I had to use 2 order guns, one to scan if the items were in stock at the warehouse and the others to actually order. It almost broke me. The delivery truck showed up whenever, the night stock crew worked whatever hours, and all departments would work whatever load showed up. On top of all that, we had customers reaching over our shoulders for products and sometimes into the cases before it even hit the shelf. There was always someone not wearing a mask in the store, and it was up to myself and the other managers on duty to enforce the policy. I've been screamed at and threatened to be laid out. After that, I started to carry pepper spray while at work. On the plus side, we all got a lot of hours. However, that was accompanied by a lot of stress. Thankfully, our employer paid for us if we tested positive. But if you were sick and tested negative, you were excused but not paid, unless you decided to use your vacation. Again, here we are, essential workers, having to make the choice to use our vacation to keep the money coming in or to not get a paycheck. We did receive some temporary hazard pay in the form of higher hourly rates and bonuses at some point so far during the pandemic. After our most recent contract was voted in by workers this February, we received another one-time hazard pay payout from our employer that was negotiated under union contract. Make no mistakes, it wasn't just given to us by our employer. We are a union and had to negotiate for that extra cash. While these payments are appreciated, they are a start, an example of what should continue to be practiced for all essential workers during the COVID pandemic. I also saw what was happening to my fellow essential workers in other industries when I was on and off the clock. A lot of nurses would grocery shop in the morning after shift change. The nurses would tell us, "Thank you for the work you are doing." And we'd be like, "No, thank you for the work you are doing." My sister runs a home daycare. I was terrified about bringing COVID home to the kids. My routine was come home, shower, and change into clean clothes. All of the families whom my sister watched were essential workers in their ranks. A 5-month-old baby in my sister's care got COVID from his father. Then my sister and I got sick too. She was closed for almost a month in December. Imagine the families having to scramble to find childcare, and my sister out of work for that long. Thankfully, it was contained to us and that one family. My story is not just about me. It is about thousands of deserving essential workers who continue to put their lives on the line during the pandemic across the state, especially the workers who do not have a union to help them. Please make it right. Include all essential workers in the Frontline Worker Pay Program. Thank you for your time.
Thank you, Ms. Huber. Questions from committee members? I thought that summed up exactly what our mission is very, very well. Thank you for your testimony.
Thank you.
In addition to the members or the individuals who signed up to testify, we also have written testimony, which is available in the packets of the working group members, and it's also posted on the LCC committee's working groups website. And it's we have written testimony today from the Minnesota Coalition for the Homeless, Minnesota Medical Association, Minnesota Home Care Association, Minnesota Trucking Association. We have an email from Tammy Nesgoda in Duluth. We have an email from Heidi Johnson, and we have a memo from the Center for Economic Inclusion. So To your point, Senator Murphy, lots of people are making very strong cases for why their work not only was essential, but was at heightened risk. And I think as we go through discussing data and understanding mechanisms for how we can make payments, it's important that we continue to hear the stories from people that we might not first think of when we think of frontline workers. I'm guessing sex offender counselors were not the first people thought of when they thought of frontline workers, and yet their lives were on the line in a way that many people's were not. So I think it's important that we will continue to hear from workers as we go through this process. And I found the start of the discussion on what we can do, to me, from DEED today, and I think as we continue with other state agencies, really, really important, because what we might aspire to accomplish, it might very much run into the roadblock of what we can do mechanically, and it's important for us to understand where those two things come together. Any further comments or questions or conversation from working group members? Senator Murphy.
Thank you, Mr. Chair. Before we heard testimony, you made mention of the idea that we should each be thinking about criteria. Are you planning to formalize that? Is that something we should prepare for as members to bring to a hearing?
Senator Murphy, that's a good idea. I'm thinking that today is Thursday, and in a week's time, that should be ample to come up with a homework assignment that we could bring back. I know that to the extent that members of the working group want to have conversations with others or potentially among themselves, as long as it's not forming a quorum, I think that would be useful, because the more we can narrow that down together, the better off we're going to be in coming together around an agreement. So at your suggestion, if members would come forward with a set of criteria for the Thursday meeting next week, we can compare notes and have some discussion, which will help then guide the technical elements of what we're trying to accomplish here. I see nods from Senator Murphy and Representative Frazier, a nod from Commissioner Doty, a nod from Commissioner Robertson, and I don't see signs of protest elsewhere. So, Representative Frazier.
Just, I don't have any protests. I just have a question in terms of what we should look forward to for the meeting on Tuesday.
That question, I think, would be directed to Senator Housley. Senator Housley, do you have a preview for Tuesday? Not hearing Senator Housley. So the agenda will certainly be posted. I do know that we have a schedule that we're kind of working to put together a schedule for the next couple of weeks. Yeah. And I think we will try to circulate that to the working group and then have an agenda that is posted, so that's available for the public as well. So we have a little bit more of a forward look. We've been working with the agencies on their schedule for presentations. And I think diving into some of the particular sectors could be a next step that we want to go down. And I think we'll try to circulate that as much as we can, with as much notice as possible. Senator Murphy.
Thank you, Mr. Chair. And in the vein of forward thinking, I do want to echo what I believe it was Senator Kiffmeyer raising, that it'd be useful to hear from the Commissioner of Health at some point. I also wondered, as we were having that data discussion, if we shouldn't be thinking through what we might learn from unemployment insurance, and if there's data there that can help us shape or add to the picture that we're trying to draw.
Senator Murphy, it's a good idea. I've been assuming that DEED would be covering that, but I think as we develop criteria and ask them questions, I think they will be pulling from all sorts of sources. And we can certainly invite Commissioner of Health. I had thought that Commissioner Robertson might kind of present from a health and safety perspective. That I know that will include a lot of information from health, but I think if you would like Commissioner Malcolm here, we can certainly invite her. Senator Murphy.
Mr. Chair, I'll be happy either way.
Okay. Commissioner Robertson.
Mr. Chair, Yes, Labor and Industry is preparing to present to the committee, I think in the next week or the week thereafter. We have called for significant information from the Department of Health, and we will do our best to present that, in anything that is beyond our ability to explain in a reasonable way. We'll certainly call on health to be available to provide us an assistance. But I think that we're gathering the information. Once we have the information, we can determine the best approach in terms of presenting it to the committee.
Thank you, Commissioner Robertson. Seeing no further discussion for today, we are adjourned.
Recording stopped.